Hey, welcome everybody. Pat Berger here, lying in bed sick, but I'm
Oh
tuning
no.
in. But I'm only here to just say thank you, thank you, thank you for coming. And I want to remind everybody, of course, that the nonpartisan nonprofit, the League of Women Voters of Larimer County, does a lot of really great work here. And we try to make sure that everybody understands our nonpartisan stance. And so I repeat it often. Our mission is to empower voters and defend democracy. And that means that we never, never, ever support candidates or parties. That's what nonpartisan means. It doesn't mean we don't take positions like perhaps some of what will be discussed tonight. But we do take positions, and they're grounded in the deep and thorough studies that we do before we decide on supporting a position. And so again, thank you so much for coming. And I'm sorry I'm in bed, but I'm listening in. And again, thanks for coming. Okay, Sue.
Thanks for being here, Pat. That's Pat Berger, the League of Women Voters Larimer County president, going above and beyond duty and joining us as she's sick. So we wish you well as you feel better there, Pat.
Thank you.
Yeah, I'm Sue Taigman, and I'm moderating tonight on behalf of the League of Women Voters Larimer County Healthcare Team. And as Pat said, we are nonpartisan, but we do take positions on issues. And so relative to healthcare, we actually have a position that says we promote a healthcare system for the United States that provides affordable access to a basic level of care for all US residents, including behavioral health care that is integrated with and achieves parity with the physical healthcare system. So that's the backdrop for our conversation tonight. We as a team decided we wanted to bring this topic around Medicaid FUTs and other funding pressures. We wanted to bring it to the forefront given some of the challenges within Colorado and at the national level as well. And so hopefully as a result of tonight's information, you'll be better informed and feel like you have some ideas of what you can do to advocate. And as Kathy said, as she started things, this session is being recorded, and that way we'll be able to share it with people who aren't here. And what I'll do is I'm going to introduce each panelist, then we'll hear from each panelist. At the end, we will wrap up the panel discussion with a couple ideas for what you can do to take action to protect healthcare and advocate. And then at the very end, we'll do some questions and answers. If, as we're going, you have questions, by all means, feel free to capture them in the chat, and we'll monitor those as we go. In all likelihood, we'll start with those during the question and answer session, unless there's something we can answer quickly during our time together. Also, if you have any resources, websites, things that you want to share, feel free to enter that into the chat as well as we're going. So with that, I'd like to introduce our panelists. Joining us from the Colorado Consumer Health Initiative is Adam Fox. He's the deputy director there, where he's worked since 2011. And he's developed deep policy expertise across a range of health policy topics and uses that to advance affordable and equitable healthcare for Coloradans. Adam is currently leading the Protect Our Care Colorado coalition and campaign to push back against devastating cuts to Medicaid and the Affordable Care Act. And we'll hear more about that initiative as we go. So welcome, Adam. CYNDI DODDS is with us as well. She is the interim CEO of SummitStone Health Partners. She's a strategic visionary with over 30 years of operational, clinical, and executive leadership experience in community mental health. A champion of health equity and innovation, successful in driving growth and advancing impact through program development, integrated care, service expansion, and fiscal stewardship. She's committed to shaping the future of behavioral healthcare through partnerships, compassionate client-centered care, stakeholder advocacy, and enduring operational excellence. Welcome, CYNDI. Dr. Bernie Birnbaum is a family physician and the Associate Residency Director at the Fort Collins Family Medicine Residency Program, which is part of Poudre Valley Hospital. and is an assistant clinical professor of family medicine for the CU School of Medicine. He has a long-term interest in the care of the underserved, community medicine, and public health, and he has served on the board of directors for Larimer County since 2016 and was elected to the board of the Health District of Northern Larimer County from 2008 to 2016. Bernie moved to Fort Collins in 2006 after spending 4 years working with the Navajo Area Indian Health Service in Chinle, Arizona. Welcome, Dr. Birnbaum. And joining us a little bit later this evening will be Q Hamidza. He's a local Medicaid recipient, and he's going to share his lived experience coming to and getting integrated into life in Fort Collins. Specifically, he's going to share the importance of Medicaid for the health of himself and of his family. So we'll welcome him when he's able to join us. So with that, thank you all for being here. And we're going to start with Adam Fox, who's going to provide an overview of the fiscal situation in Colorado and specifically in Larimer County. So over to you, Adam.
All right. Thank you so much, Sue. And thanks everybody for having me this evening. Look forward to the conversation here. You can go to the next slide. For those of you who aren't familiar with CCHI or the Colorado Consumer Health Initiative, we are a statewide, also nonpartisan, nonprofit membership-based organization. And really, our purpose is to make healthcare more affordable, more equitable, and accessible for all Coloradans. So we do a lot of work at the state policy and regulatory level. Sometimes that's watchdogging the insurance companies. Sometimes it's seeing what we can do around hospital transparency. But a lot of it is ultimately focused in how we can expand access and affordability for healthcare for all Coloradans. We also provide a consumer assistance program that helps folks navigate medical billing issues, challenging situations like insurance claim denials and filing appeals, all of those fun things that unfortunately are a little too common in our healthcare system. And then we do a lot of organizing and community engagement and education. And since we are membership-based, a lot of what we do is always in coalition with other organizations, as is the work that we're going to be talking about tonight. Next slide. So want to start with sort of the budget picture that we have at the state level, because it really helps frame how we need to understand the proposed cuts that are being discussed. So this is looking at Colorado's state budget and how we allocate our state dollars. This year, for the first time, healthcare has creeped up above K through 12 education. They've usually been pretty close to parallel for quite some time, but what we've seen is with rising medical costs and also more people aging in Colorado, the claims that are happening under Medicaid are becoming more costly, or there's more of them over time. And so that's putting some pressure on our state budget, frankly, and we'll talk a little bit more about that. But you can see how we're allocating dollars at the state level, and a big portion of it is going to healthcare. I'm seeing somebody in the chat saying they can't see the slides. Is that true for others?
I'm seeing the slides.
Okay. All right. Next slide. So part of the challenge that we are facing at the state level is fundamentally tied to our tax laws, and specifically the Taxpayer Bill of Rights, or what's commonly referred to as TABOR. So the budget that our legislators are really grappling with right now, they are trying to fill a $1.1 billion gap in our state budget. And a lot of that gap is just essentially our state budget is not keeping pace with inflation or the caseload, or frankly, the evolving needs of our population over time. It's not really a structural problem beyond that, but because of Tabor, we are essentially going to be lacking an additional $500 million that we could have in the state budget to cut that gap in half. It wouldn't totally fix the issue, but if you also take into account how much we've refunded back to taxpayers under the Taxpayer Bill of Rights, we've more than kicked back funds to taxpayers that would really help us cover some of these budget shortfalls that we are likely to face in the coming years. So last year alone, we refunded 1.6 billion back to Coloradans. And if you look at the time period since 2022, $8.5 billion. And really what we see is because of sort of the structural constraints that Tabor puts on our state budget and how we raise revenue and can't really change how we raise revenue, we're not bringing in enough money to fund the budget going forward. And so that's going to put increasing pressure on Medicaid, on K through 12 education, and all of the other buckets that you saw on the last slide. But then you factor into that the potential cuts to Medicaid, and it becomes much more dramatic. And then if you take into account the potential of an economic downturn because of tariffs and the other things that are happening federally, we are looking at a pretty uncertain scenario that is pretty scary for how things could play out in the state. Next slide. So we do get a lot of funding from the federal government, not as much as many states. We end up paying more to the federal government than we get back as a state, but we still get $12.5 billion on average from the federal government to fund a lot of the programs that we provide. And that is funneled out through state programs. Next slide. The bulk of it is really going to our Department of Healthcare Policy and Finance and Medicaid. So you can see here 72% of those federal dollars are going to the department that oversees our Medicaid program, and the vast majority of those go to Medicaid directly. So that is funding care for Coloradans. Next slide. So what they are talking about at the federal level is using what's called the budget reconciliation process to cut at as much as, or at potentially more than $880 billion in Medicaid. The way that it is framed in the budget resolution that has passed, the language says at least 880 billion. So that's sort of the floor that the committees are going to have to try to reach. How they are going to do that is an open question. There are some potential cuts to Affordable Care Act programs and coverage, which we will talk a little bit about, but the biggest cuts are on the Medicaid side. But I also didn't want to omit the potential cuts of around 300 billion to food security programs like SNAP, school meals, as well as TANF. Next slide. And why they are trying to make these cuts to these vital programs is to continue the tax cuts that were passed during the first Trump administration that really overwhelmingly benefit wealthier individuals and large corporations. So they are looking to extend those tax credits and are looking to make these cuts essentially to pay for those tax breaks for wealthier individuals. So I think we have to put it in that frame of sort of how they are thinking about this. They're looking at Medicaid as essentially a pay for tax cuts for people who may not need it as much as the people need Medicaid, frankly. Next slide. So both the Senate and the House have passed a unified budget resolution. There is still a lot of detail that they have to start working through. They are on recess for this week and the following week. But when they return, they're going to have to start the work in committees in DC to really spell out what cuts they are going to try to make to get to that $880 billion number. Both chambers have to agree on those cuts, and they both have to pass the same reconciliation package. And there is a fair amount of division between Republicans as to what that can or should look like. So there's still a lot of ground for them to cover to get through this process. Next slide. So when we're thinking about the state as a whole, Medicaid covers over 1.1 million Coloradans. If you add the Children's Health Insurance Program, or CHP Plus, that bumps it up a little over 1.2 million Coloradans being covered through those programs. The folks that are covered in some semblance from some of the Affordable Care Act protections or financial assistance through Connect for Health Colorado, you can see sort of spelled out here. So there are essentially close to 2 million Coloradans who are at risk in some way, shape, or form from higher costs in their healthcare, if not losing coverage altogether. Next slide. A lot of people don't necessarily understand some of the differences between Medicaid and Medicare, so just want to provide a very quick overview. Medicaid is typically a partnership program between federal and state governments. Usually the split is around 50-50, so the federal government pays 50%, the state pays 50%, but there's a big exception, and this is an important one to understand. The Medicaid expansion under the Affordable Care Act was funded with the federal government paying 90% and the state paying 10%. We'll talk a little bit more about that in a minute. Medicaid covers older adults, people living in nursing facilities, people living with disabilities, family care providers who are caring for somebody on Medicaid, pregnant people, families, lots and lots of children in Colorado. It is a highly efficient, cost-effective program compared to other health coverage systems. And when we look at the rural population or rural parts of the state, oftentimes 30% or so of the population is covered through Medicaid. So it's really a fundamental underpinning for hospitals, safety net clinics, and really all of our medical providers. Next slide. So Larimer County, so that you have some basic sort of context as to how Medicaid plays out in your area, there's just shy of 20% of the population that's enrolled in Medicaid. 20% is about the state average. That includes roughly 68,000 average members being enrolled in Medicaid a month. 28,000 of those are covered under the Medicaid expansion. 23,000 of them are children. And the expenditure going to Larimer County itself is just shy of $580 million in Medicaid funding that goes into your county. And then just wanted to pull out the number of residents in Larimer that are enrolled through Connect for Health here, just shy of 20,000 people. Next slide. So right now, the Republicans control the presidency and both chambers, but their margins are very slim in both the House and the Senate. And so there's a lot of effort to encourage Colorado's Republicans in our delegation to sort of buck the trend and say no to Medicaid cuts. In particular, a lot of the targeting is going towards Representative Evans, who represents a few small pieces of Larimer County, and Representative Hurd, who's in Congressional District 3, because they are seen as potentially more movable, both because of their districts and because of how they have engaged in the conversation. Next slide. A lot of the cuts that are being talked about have really been framed in terms of like fraud, waste, and abuse, but that's really not what we're talking about. What they are talking about are things like implementing Medicaid work requirements, which we know would significantly increase administrative burden and really affect all enrollees by creating more barriers for them enrolling in care. Everywhere we've seen Medicaid work requirements tried, they add administrative cost and they take coverage from people who need it and who qualify. They don't work. Another big thing that I want to highlight here is they're talking about changing how states can use provider fees or taxes. This is how Colorado funds our Medicaid expansion. Our 10% is funded through a fee on hospitals. It is managed through an enterprise and a board that is transparent, that has to do reporting and everything. But that mechanism funds coverage for our entire Medicaid expansion population for the state portion, and a few additional expansions of Medicaid that we've done since. So we're talking roughly 427,000 Coloradans. It has also allowed us to support our hospitals better with better reimbursements. And so if they'd make changes to this, it could essentially wipe out our ability to have expanded Medicaid under the Affordable Care Act. So we're talking over 400,000 Coloradans who could lose coverage. Similarly, they might try to change sort of that percentage from 90-10 to, say, 50-50, like the general matching rate. That would also be nearly impossible for our state to fund because of the Taxpayer Bill of Rights. Next slide. So all of this is to say, any cuts that we see to Medicaid at the federal level will lead to significant cuts in coverage and benefits at the state level. Given where our state budget is and sort of the forecast that we see going out, there's no way that our state is going to have any flexibility to respond to federal cuts. And so really it's going to force an impossible decision of who gets coverage and care and who doesn't. We also know that many hospitals, clinics, providers will be at risk of potentially closing or reducing services. And the overall economic benefit for Colorado is substantial. A recent study from the Health Foundation found that for every 1 million lost from the federal government, Colorado loses 2.2 million in economic activity. Thousands of jobs are put at risk, and we lose an additional $825,000 in added household earnings. It's a substantial economic driver. Next slide. The last thing I want to highlight, this is not being talked about necessarily, well, it may get wrapped into the budget conversation, but it may be handled separately. At the end of the year, the tax credits through being offered currently through Connect for Health Colorado and through marketplaces across the country will significantly decrease if Congress doesn't act. So right now we have what are called enhanced premium tax credits. Those went into effect during the pandemic, during COVID. Those are set to expire at the end of this year. Of the enrollees in Colorado, 80% receive financial assistance, and anybody who is receiving financial assistance currently will see their out-of-pocket premiums increase an average of 50% if these go away. And in rural areas, that'll jump up to about 70% on average. And just a reminder, there are almost 20,000 enrollees in Larimer County. Next slide. Oh, I guess we'll hand it over to Cindy.
Thanks, Adam. So CYNDI DODDS, Interim CEO at SummitStone Health Partners, really want to thank everybody on this call tonight and thank the league for sponsoring it. It is a critical issue. Next slide. So let me get myself there. Thanks. Just a little bit about SummitStone. We have been transforming lives through recovery, renewal, and respect for the last 65 years. We're a 501c3 dedicated to behavioral health prevention, intervention, and treatment. We offer comprehensive services for people of all ages and all backgrounds. Our vision is to make Colorado the healthiest community in the nation, and our mission is to serve communities by fostering trust, empowering recovery, and inspiring hope. Next slide. A little in terms of the guiding values that really SummitStone tries to lead into in everything that we do. We believe in come as you are, which means that we believe people can and do recover no matter where they are in their journey. We also work to start with yes, reflecting our commitment to showing up for our clients, our staff, our community, and partners. We work to boldly raise the bar, meaning that we continuously work to improve the quality of behavioral health care, and we believe we're stronger together, acknowledging the importance of embracing differences in race, ethnicity, ability, age, gender, sexual orientation, spiritual beliefs, socioeconomic status, and language. So as we think about the work that we do, our mission, our vision, our values, and really looking at what is the need for services. So if we look a little bit around where we're at in Larimer, 1 in 3 people report poor behavioral health. 1 in 6 report poor mental health, and 1 in 10 Coloradoans are affected by a substance use disorder. And we really see that post-pandemic need just continues to rise at the same time that the safety net. So SummitStone is a safety net, and any of our other safety net physical health care providers, we're seeing our resources dwindle. So rising demand and dwindling resources. To set the stage in terms of kind of mental illness and impacts in Colorado, we know the rate of mental illness throughout Colorado is about 33% among Medicaid adults. And of those Medicaid adults, 12% of those adults experience a serious mental illness. We think that Medicaid is particularly strong in letting folks with mental illness access care. And we think it is vital to really that whole care system. Really, and we know that with appropriate care and support, recovery is possible. Next slide, please. So we really see Medicaid as a foundation of care. It is the largest payer for behavioral health services in the U.S. It is critical to the safety net. And Medicaid covers really the full range of behavioral health services, which is unlike a lot of private insurance. So it's going to include traditional therapy that I think most of us have, understand, have experience with. Medication management, which can be critical both in doing solid mental health and SUD or substance use disorder work, offers case management. And we know that with people on Medicaid, that they actually engage in treatment at higher rates compared to those with private insurance and uninsured. So for folks that have Medicaid, they engage in treatment, behavioral health treatment at about a rate of about 59%. Private insurance is 55% and uninsured is 37%. So really an important way to access care. And as Adam talked about expansion, I think I'm paying attention to, and all of us really recognizing what happened with the expansion community that allowed really where we've seen it on the behavioral health side. Individuals without dependent children has been significant in helping adults get care. And then the whole substance use disorder treatment expansion really has been very impactful for behavioral health. So to see that potentially be at risk is critical for us. And we really believe if those go away, there's people that will disengage in care and not seek treatment. Medicaid really serves those that are most vulnerable. I think Adam has covered that, but thinking about families with limited resources, people with disability, children from low-income households, and it's our neighbors, it's our colleagues, it's our essential workers. And I think many people are just one job loss away, a divorce, a healthcare crisis from needing the support of Medicaid. It's very important. Next slide, please. So I think Adam talked a little bit about the impact or the impact as you cut Medicaid, what that does to our community. I want to talk a little bit about the impact specifically to as we invest in Medicaid and what that does related to behavioral health. I think this is a little bit of a penny wise, pound foolish conversation. We know, and for some time, this has really been a very strong number. For every dollar invested in Medicaid, in healthcare, behavioral healthcare, we have $4 of savings that come through other systems that are not used. And so Medicaid really can create a powerful multiplier effect in our community. So again, you think that $1 you invest in behavioral health, you're going to save $4. And it really is because people are getting the care that they need and they're not using the emergency room. They're not using ambulances. We see decreases in homelessness. We see fewer interactions within the criminal justice system and other parts of our system. So we really know that if we can invest in getting people the care that they need, we're going to benefit across the entire community. The other thing that we can look at in terms of Medicaid community impact, and I think a story specific to Larimer County, is our remarkable progress in suicide prevention. We have seen a 28% drop in suicide rates in Larimer County since 2019. We are the only county in the state to see these year-over-year gains. It has equated to 20 fewer deaths since if you look at 2023 to 2019. So it is life-saving. And I think Medicaid is part of this story. And without it, we will lose ground in this really important area. And I think that ability to have Medicaid funding, to have that coordinated care, it is crucial, and it allows SummitStone to provide comprehensive care for those who need it most. So we think this is a piece. We don't want to lose these grounds and get cuts to Medicaid. We think that that is possible. Next slide, please. I know we're going to hear a Q story later, but do want to talk a little bit about transforming lives and stories of recovery. And it really is, this is the power of what's possible when people can get the care that they need. So the first story I'll talk about is a struggling student to future builder. And it was a young client, I'm going to call him Tim. He was in high school, and folks struggling with or being diagnosed with a significant mental illness, it is not uncommon to see that high school, college years as a time of risk for them. And so Tim, we had got connected with him. He was failing in school, struggling socially, family becoming very worried about him. And through our Medicaid Ascent program, we were able to really wrap around him very important medications to get him on, many medications that families could not otherwise afford, therapy, case management, some education support. He's now got straight A's. He's studying carpentry, and he's looking to attend a community college so he can go into the construction industry. And really without that, I think Tim's story could have been one in which, as he left home, potentially went into homelessness and sort of that journey on that would have been very different for him, his family, and I think for us as a community. Another example is a gentleman, John, not his real name. He spent 7 years on the streets. And frequently was using the emergency services. He was interacting with police. He was really using some of our most expensive systems. We were able to get our Medicaid outreach team connected with him, built trust, got him into therapy, case management, again, medications. He has now been in stable housing for over 2 years. And really those supports that we invested and used when we worked with John, and that cost to the Medicaid program is far less expensive than the emergency services and the criminal justice services that he had been using. So really another story of how Medicaid helps people if you can get them the right care in the right setting. And again, when somebody recovers, their family, their workplace, the community, we all benefit. It is a ripple of change. And we are extremely concerned. Cuts to Medicaid will terminate healthcare for more than 1.4 million Coloradans. These are children, seniors, veterans, people with disabilities. And again, we will pay for this in lots of other ways if these services go away. So we really believe that protecting Medicaid funding isn't just about keeping services open. It's about giving our neighbors the chance to rebuild their lives. And that's what we do at SummitStone. We help people transform their own lives through recovery, renewal, and respect. And we're asking all of us to do everything that we can to preserve this vital funding that helps people in our community climb their own personal mountains and reach their summit. Next slide. So this is just a little bit, if you're interested in hearing more about SummitStone, we would invite you to consider supporting our mission. If you've got questions, please reach out. We really do believe that Medicaid is essential infrastructure for behavioral health care. And want to work to make sure that we can be a provider and anybody that needs services in our community can get them. So I want to thank everybody for taking the time tonight to listen to this important topic. And I think I'll hand it over to Bernie.
Hi, all. I'm Bernie BIRNBAUM. I'm a family doctor with the residency program here in town. I've been in the community about 20 years. I'll just give a little caveat. I'm speaking as a private citizen, not as a UC Health or public health employee. And I just want to put it out there. I've been on the Speakers Bureau of Physicians for a National Health Program. I believe that healthcare is a human right. And Medicaid and Medicare and the services that we provide through that allow people who are otherwise vulnerable to take that fear of not being able to get health or not being able to get better out of their pockets. At Family Medicine Center, we did a little study a couple years ago that led to us opening a food pantry. And that food pantry came about because we asked a simple question of people who came in. Do you or someone in your family sometimes struggle to buy food and feed yourselves? And do you have to choose other things in order to eat? And the answer to that was that 70% of our patient population was food insecure in any given month. Anybody want to guess what percentage of patients we serve with Medicaid? 70%. Because if you have Medicaid, by definition, you're going to be food insecure. And I think what we're looking at is people's ability to choose health versus food or health versus housing. And that choice is already being made, but we're the only country in the world that allows that to happen. The only country, industrialized country in the world that allows that to happen. Next slide. I apologize if some of the data that I give is duplicative to what Adam gave, but 70%, 70 million Americans have Medicaid. So just imagine that 30% of those people lost their health insurance tomorrow. What would the ramifications be economically to the healthcare system? Medicaid covers nearly 40% of children nationally and almost 50% of children in Larimer County. It provides 60% of the care for people with disabilities. So people with disabilities may get Medicare, but Medicare only funds 80% of care and doesn't fund the home health services that they need in the home. One of $5 in the U.S. health market comes directly through Medicaid. The federal dollar is somewhere between 40 and 55%, depending on who you argue with about this. So these are big numbers. Medicare spending grew 8.1% in 2023. It's 21% of our healthcare expenditures. Medicaid is another additional 18%. So that comes to about 40% in this data from the CMS website. Next slide. In 2024, about 68,000 of our neighbors had Medicaid. Larimer County has approximately 350,000 people. That's 23% of the population. And that's actually smaller than some of the other counties, or many of the other counties in Colorado. I'm going to keep hammering this point. The largest category of spending is not doctor's visits. The largest category of spending is long-term care. And we have to think about what would be the ramifications of not spending that money. 23,000 children in Medicaid in Larimer County have Medicaid. That's almost half the population of children in the county. And as I said, this is among the lowest rate statewide. I got this data from the health department. Next slide. There are really three major outpatient Medicaid providers plus SummitStone for mental health services. There's Salud Family Health Center, Sunride Community Health Center, and Family Medicine Center. And our practices carry the weight. Between 55 and 70% of the patients at Family Medicine Center have Medicaid, and we're attributed 10,000 Medicaid patients. We only have about 12 to 14,000 active patients, so I know that those numbers don't add up. But those patients rely upon these safety net clinics to care for them. And our budgets rely upon Medicaid. SummitStone you heard about already. The private sector in town sees a small number of Medicaid patients relatively, but does see patients. And then both Banner and UC Health provide a tremendous amount of care to the Medicaid population. Next slide. So let's talk about consequences. And I'm going to try to make these consequences feel real from stories of my patients. Loss of access to care is obviously the most obvious one. But financial distress of safety net providers, hospitals, and skilled facilities. If our safety net providers disappeared from town, that would be between 40 and 50,000 patients that would not have health care at all. That would not have a place to go to the doctor. There'd be an exacerbation of health disparities, especially for children living in poverty and people with disabilities. I take care of one child who has fetal alcohol syndrome. He's cared for in the foster system, and without the care management that's provided through Medicare dollars, this kid would have absolutely floundered. He actually gets his care through SummitStone, is about as well managed, I think, as he could be. And he's going to turn 18. And if he turns 18 and disappears from the system because he can't be covered by Medicaid, he's hosed. And we're hosed because somehow we're going to have to take care of this. When I say we, I don't mean Family Medicine Center. I mean we as a society are going to have to figure out how to care for these people. We're going to see exacerbation of mental health crises, and I think CYNDI talked about that very eloquently. I really want to hammer on the ramifications to the home health system. This is incredibly important. People with disabilities and elderly get long-term Medicaid. And the reason they do that is that Medicare does not provide any chronic long-term health care. Medicare will provide acute rehabilitation services and acute home health care for an acute need. Once it's no longer acute, Medicare doesn't cover that anymore. And so our elders who live at home are able to stay at home because of Medicaid. And if they need a facility, they're able to go to that facility because of Medicaid. But one patient who I take care of is a retired professor who's an English guy, went blind, is at home. It's kind of amazing that this person's able to be at home. He can't manage anything for himself. His son is compensated through medical long-term care to provide him care. That combined income of his Social Security and his son working there feeds them. And again, like, feeds them. The son could go out and get a job, but if the son got a job, the father would have to be institutionalized. So these are direct ramifications. And then I think it's worth talking about the downstream economic consequences. I think Adam showed a number of how much money is spent. Was it in Colorado or Larimer County, direct from Medicaid dollars? Imagine that even a third of that money went away. What are the ramifications on housing in Fort Collins? What is the ramifications on people being able to send their kids to school? How many people are going to lose their jobs? And what are the ramifications of that? Next slide. This was just, I wanted to hammer home the nursing home thing. Medicaid cuts would decimate the nursing home industry and reduce accessibility of home and community-based supports, particularly for people with low income and complex health needs. I hope everyone on this call has effectively saved more money than they ever thought that they would see in order to pay for their long-term care. Because if you didn't, and this goes away, you're probably in deepest doo-doo, which is a medical term. Next slide. There was a new report from the Commonwealth Fund and George Washington University School of Public Health that warns that potential budget cuts to Medicaid and the Supplemental Nutrition Program could trigger severe economic consequences across all 50 states. And I think that this can't be overemphasized. This isn't just about healthcare for poor people. This is about all of our jobs in our economy. If implemented, these combined cuts could lead to 1 million jobs lost, 113 billion decline in states' gross domestic product, 8.8 billion lost in state and local tax revenue in 2026 alone. Next slide. And then I finally wanted to hit the SNAP program, and Adam mentioned it a little bit, but I think historically we've tried to separate mental health and physical health, and we've tried to separate our public health and our food system from our physical health. But our physical health and our food system and our mental health system are the same thing. And I think that we really need to understand that. The state gross domestic products are estimated to shrink by 18 billion in 2026 due to a reduction in SNAP funding. 143,000 jobs would be lost nationwide based on the proposed cuts to that, with 78,000 jobs in food-related sectors and 65,000 jobs in other industries. State and local tax revenues again would decrease by 1.8 billion, further straining state budgets. SNAP pays for people to go to the grocery store. The grocery store employs people with good jobs, right? I mean, like, if you work at a lot of the grocery stores in town, you can get health insurance through your job. So as those people lose jobs, what's going to happen there? I just think I'm not trying to be dire, but I'm frankly personally panicking. And I think we need to ask the question is what is our individual roles in helping to care for our fellow citizens? And it seems to me that we have a big responsibility there. And that's what I got.
Whew. Thank you, Dr. Birnbaum and CYNDI and Adam. It's a lot to take in. The ramifications of what we're facing here are pretty catastrophic. And, you know, as you highlight, you can't separate the healthcare from the housing security, from the food security, everything's so intertwined. It's massive, massive impact. Before we go to the slide that's up right now, I want to check. We do have a fourth panelist, and I'm not sure whether Q, there's a few iPhones showing in the people attending, and I just want to see if Q has joined us or not. And so Q, if you're in the forum, would you please speak up? Take yourself off of mute and speak up.
Actually, I just texted Q.
Okay.
He is not on yet, but he is actually long story, a pilot also, and he is getting recertified as a pilot, I believe, as we are here tonight. So he said he just landed and it should be good. He will be on at 7:30. So I think we will just go forward with other questions until he gets here.
Great, thank you, Beth. So we'll bring in Adam and his story, his experiences of a Medicaid recipient, and actually having a lot of success getting he and his wife, I believe, off of Medicaid, but still having a need for the rest of his family. So we promised that we would wrap up this part of the discussion with some ideas of what we can do as a result of this information. And it's really key. I suspect that nearly everybody here wants to do something. And so the first item on this slide that Kathy's got up here is directing people to Protect Our Care Colorado. And there's a lot of things on there, incredible community partnerships and an advocacy kit. And Adam is heading it up right now. So would you speak to this one, please?
Yeah, so we started Protect Our Care Colorado back in 2017, well, really 2016, when it was clear that the ACA was at risk of being repealed, and when we were also having to defend against Medicaid cuts in 2017, 2018. But it sort of went dormant for a little while because there wasn't the need, and it's back. So we've populated that with as much content, and we are continuing to add pieces and tools for folks to use for your own advocacy. And really, like, any help collecting or sharing stories right now is really important, because I think people generally have a good opinion of Medicaid, which we don't always think they do, but polling shows actually there's pretty broad support. But people don't understand who is really covered and who benefits, and that's where the stories really matter. So feel free to join us through the Protect Our Care Colorado website, and you can always reach out to me directly as well.
Thank you, Adam. There is a question in the chat as to whether it's specific to Colorado.
So there is a national Protect Our Care sort of coalition. It is mostly organizations based in DC. We started Protect Our Care Colorado before that Protect Our Care came into existence back in 2017. And we do coordinate with them and try to share resources and whatnot that we're getting from our national partners that can really be leveraged here at the state level.
Wonderful. Thank you for that. Clearly, I'm sure that many of us have been already contacting our representatives and senators, and so continue to contact them specifically focused on healthcare, protecting Medicaid dollars, protecting the funding within Colorado, and of course, locally in Larimer County. Doing what you need to empower people with information. So sharing what you learned tonight and using things like our League of Women Voters website, which is listed here for information on how to defend democracy. Join protests and rallies specifically for fighting to Medicaid and healthcare access. There's a lot going on in this regard as well. There's a note here to write letters to the editor, and Kathy Wilson in the chat highlights that we can use some of the information that we're receiving here tonight to be very specific in those letters. And express your support for legislation, both for those items that support healthcare and opposing items that actually undermine access to healthcare. One of many sources that you can use to track what's going on in the realm of healthcare legislation is a League of Women Voters bill tracker. And you go to the site, it will give you a variety of legislation that we're following, and there's a specific section for healthcare, along with other things that the League is following, and so you can use that as a tracker. Next slide, please. And CYNDI, this is your slide that I moved towards the end, if you want us to go ahead and speak to this one.
Sorry. Oh my gosh, could not get myself off of mute. Really, we were just thinking about in terms of, and I think you've mentioned a lot of this too, but really the ways that please, if you could stay informed about Medicaid policies, advocate for behavioral health funding, help reduce stigma through education. I do think Medicaid is an issue for all, but am just really well aware of, I think when it comes to mental illness and substance use disorder, there is still a lot of stigma and moral failings that come along with that. And so really, I think advocating that all health, behavioral health is health, and all health, really connecting with community members to resources and supporting the behavioral health workforce initiatives. I think there's a lot as we have as we are looking at these cuts. I think one thing I'd put in this space for SummitStone is we are an organization as the entire safety net. As we came through the public health emergency unwind and some of the pieces that we hit, we have been strained systems, and we're prepared to now go into bigger fights and more strain. So would ask for any support on this front.
Thank you, CYNDI. I'd like to actually ask each panelist if there's anything you want to add based on our conversation today that hasn't already been identified, of requests you have. Is there other actions that haven't already been mentioned that you'd request or suggest people take, or things that you're doing that we can support? Anything else you want to add?
The only thing that I'll add is we have to find a way to talk to people who disagree with us. And I'm, my mea culpa in that is I don't know how to do that right now. And I think looking for those active places where we can put ourselves in a conversation with someone, and I like the idea of telling stories as much as stating opinions is really helpful. Because people with Medicaid are, your friends and neighbors and all the people that you interact with, and those people work hard. Those people aren't lazy. Those people are struggling to put food on the table and pay their rent. And so I think when we make that real for people, it's a lot harder to take a purely financial sort of calloused view of it. So that was my thought.
Thank you, and thank you for your stories tonight. That really did bring the points to life. CYNDI?
So I would, and I do think we've talked about advocate. We are saying, say it seven different times in 7 different ways. Call, write a letter, email. I don't think you can. I don't think we can advocate too much and let our representatives know too often. So do it multiple times. I think it is just one of the pieces that I this is not a time to be quiet. And I have. Bernie, I think to your piece, how do we have dialogue? I don't believe that there is $880 billion of fraud, waste, and abuse in Medicaid. And so when you hear that Medicaid will not be cut, that fraud, waste, and abuse is going to be impacted, it's got to go beyond that. And so for us just to be real about that and maybe know those numbers, I think is another important thing. And I have really tried to look at the piece of as they are looking to make cuts, cutting Medicaid is penny wise and pound foolish. We will pay for this over and over and over again if these go through. It will cost us tremendously more than keeping Medicaid intact.
Thank you, Cindy. I've come to really appreciate what you're highlighting here, that we can either take care of people upstream, or we can pay for it in homelessness, in the criminal justice system, in the ER system. I mean, that it's if for no other reason, financial sense, and of course a better reason would be care of our community. So thanks for connecting those dots. Adam, I saw you coming off mute there too.
Yeah, I was just going to build a little off of what Cindy was saying. I think in general, what we know, like all of the polling recently, people like Medicaid. They don't want to see it cut. So we're generally already starting from a place of where people don't want to see this happen. But I think what Cindy highlighted and how it's being framed right now as waste, fraud, and abuse, which it's not, that is the challenge, because we do run into challenges based on what I've seen from polling and focus groups, that it is an area that we need to work harder at. But the reality is Medicaid is it's the most efficient program we've got to cover people, and it provides services that other health coverage programs don't. And it is like I think of it like Jenga. If you pull out one of the bottom blocks, you're knocking the whole tower down. Medicaid is that bottom third of the stack of blocks. Like if you start taking pieces of it, it's going to topple, and it's going to have really devastating impacts. And I think, to Cindy's point, advocating any and every way that you can, now is the time to do it.
Wonderful. Thank you. Well, I know I'm inspired to do something, do more than I've been doing, that's for sure. So thank you all. We're about to shift, and Kathy, you can go ahead and take down the slides, I think, so we can see each other on the screen. And we're going to go to a Q&A period. If you have questions, I see that there's probably some that have been coming in here in the chat. So in a moment, I'm going to start with some of the questions in the chat. If you have questions, by all means, feel free to add them to the chat. Or like Ruth has already done, you can raise your digital hand, which, if I remember right, I don't know where it's at these days. Maybe Kathy, you could help me. Where's the raise hand function?
It's down below under React.
Right. Yeah. Some interfaces will have it separate. It depends on your operating system and your version, but down there along the toolbar at the bottom, usually under React.
I see that. Thank you very much. So yeah, it's easiest if you can raise your digital hand using one of the buttons at the bottom. If you don't know how to do that and you want to just wave to us, we'll look for you as well. But let's go ahead and start with a question in chat. I see that there's a few, and let's go ahead and we've got people here to help us. Beth, what are you seeing as a question you'd like to start with?
Well, one of them is for Cindy, I believe. SummitStone had to lay off staff recently. Would you tell us about that?
Yeah, so SummitStone, it was in August. So a little while ago, we laid off 75 staff, 10% of our workforce. And it really, for us, was very much connected to the public health emergency unwind and the precipitous drop in Larimer County. So Larimer County was one of the counties that saw some of the greatest drops in the public health emergency unwind, and so required us to do some adjustment in staffing. I am pleased to say that things have stabilized for us. So don't have any reductions planned at this point, but also are now needing to do a lot of very careful budget planning when we're looking at both what's happening at the state level and then potentially at the federal level.
Thank you.
Thank you, Cindy. June, we'll take another question in the chat if you have any you want to bring forward here. And we'll need you to come off of mute there.
Good idea. Okay. Did CCHI share their data with the Colorado legislature?
Yeah, we do a lot of engagement with our legislators, and did sort of a legislative preview with a good number of our legislators to help them understand the lay of the land and sort of how our state is funding healthcare and sort of how Medicaid in particular fits into that, because we knew the state budget conversation this year was going to be a real challenge. And I think we've sort of scraped by without the worst impacts this year. I'm not sure that's going to be true next year. I think our state budget is going to continue to be in a pretty difficult situation because of Tabor.
You,
Sue, I wanted to bring to your attention that Q Hamadzai has joined us.
I see that. Thank you. I think Q, welcome. We're eager to hear your story. As you can hear, we're actually in the middle of some questions and answers, and I think we'll go ahead and continue with this, and then we'll wrap up our session hearing from you, Q. So I'm glad you're here, and if you'll hang in there for a couple minutes, we'll bring you in to share your story. So welcome.
I would
Thanks.
like to, may I speak about the problems with saving the $880 billion. As someone had said, they're not going to save it through waste and fraud, and they're not going to save it through trying to get people to work. The only way they can save it, and this is being proposed, is to block grant Medicaid. I don't know if people remember how TANF was block granted when AFDC was changed from an eligibility to a specific amount that was given to each state. What would happen is that each state would get a percentage of what they're getting now from the federal government, probably a much smaller percent. So the federal would save the money. They would not be giving them a matching grant. And then it would be up to the state to make up the difference. But the states won't be able to do it. They won't be able to afford it. What happened with TANF was that they made the block grant so broad that it could be used not only for direct services, but for other ancillary services. So the state would have a lot of flexibility in how to use that money, and the direct help to people would probably be very limited. What happened in Florida with TANF is the last figures I saw, less than 15% of people who are actually eligible for financial assistance were getting anything. So if they block grant Medicaid, it will be a disaster. And that's the only way they could possibly get near to saving the $800 billion. So I have a paper on that, and I put something in the chat. You can reach me if you're interested in the paper that discusses that in more depth. But I think it's a real problem, and that's probably, I guess that's where they're going to go with trying to save the money. Thank you.
Thank you. Thank you for your work and your question. I don't know if, especially Adam, if you had anything you wanted to share.
I don't necessarily disagree. I think what we have heard from Republicans in Congress already is that they have, to a certain extent, taken block grants and broad per capita caps off the table.
Really?
Supposedly. But now that they're actually going to have to start trying to get to that, like in committee, put pen to paper, and try to figure out how they get to $880 billion in cuts over 10 years, I really question sort of how they're going to get to that, because the math will not square. And I think to the point, there just isn't that level of waste, fraud, and abuse. If you're actually looking at legitimate waste, fraud, and abuse, it's nowhere near that level. And so whatever cuts they do start to look at, it is absolutely 100% going to mean coverage gets taken away from people.
Thank you. Suzanne, I'm not seeing any other hands raised right now. Are you seeing any that I'm missing?
I don't see any at this time. Yeah.
There's a question or so in the chat.
Yeah, let's come back to the chat. Go ahead, Beth.
In earlier discussion of mental health services, I did not see Health District of Northern Larimer County mentioned as a provider collaborator. Did I miss it, or has a situation changed? I guess that would go maybe to I'm not sure who would answer that question. Anybody
I
wanna
can
take-
I can comment on that
Okay.
a little bit, and I'll try to be politically correct. The the Health District of Northern Larimer County is still involved in the provision of health services. They still have a program called Connections that people can call to get connected to services, which is actually really important, really for people who don't have Medicaid, or who people who are uninsured. And they that is an incredibly important program. They also it's on its last gasping breaths at the moment, but have a program called Kayak, which is a assessment program for children who need more urgent access to mental health services. SummitStone is insanely busy. I showed you the numbers of how many kids in Larimer County have have Medicaid, and trying to get in with a pediatric prescriber can sometimes take time. And so Kayak provides a level of assessment that that can be provided if you have a lot of money. But the majority of people in Larimer County who don't have Medicaid don't have a lot of money. Um, and so they need the assistance of those sort of organizations to get that help. And frankly, because of SummitStone and because of Medicaid expansion in Colorado, our Medicaid youth population has much better access to mental health services than people who have substandard health insurance.
Thank you, Dick.
So thank you for that. And Sue, I do see a hand raised, Hank Abrams, who I think is from California. Hank, would you like to unmute and go ahead and ask your question?
Yeah, I think I'm unmuted. So forgive me if I preach a little bit, but I just want to step outside the boundary of the Medicaid question and out of and Colorado. I'm a longtime healthcare reform advocate in California, a retired physician, and there is waste, but the waste is in the current sort of lack of coherency in care. And one of the positions of the league on healthcare is to favor the creation of a single payer program, otherwise known as expanded Medicare for all. The point about and just to talk about the economics, because the other aspects, the morality, the ethics, the quality of care, the universality are incredibly important. But I just want to emphasize that when we look at the numbers, here's the waste. The waste is in the administrative waste, the duplicativeness, the complexity of our healthcare system, and the profit for the provision of a service which really is a human right. And I very much agree with Dr. BIRNBAUM when he expressed it that way. We could have better healthcare. We could include everybody. We could include long-term care. We could include care that's much more comprehensive. We could include the cost of prescription drugs, and we could include mental health on a parity with physical health services for the money that we're spending now, and probably end up with net savings. So this is where the waste is. The waste is in the fact that we're confined by our political process to talk about protecting against Medicaid cuts and other sort of market-based reforms and incremental changes in our healthcare program. But if we really want to get rid of the waste, we need transformative change in healthcare, and we need to go to a single payer system. And so I would say not only is there waste, but there's fraud. The fraud is that the ideology is that we have to continue with private insurance and a very fragmented healthcare system. So the fraud is really on us, the voters, and the abuse is on our patients and our providers who have to labor under this incredibly demoralizing, and morally offensive system. So
Thank you,
forgive me
Hank.
for,
I wonder,
but I
so
have-
your point is really well taken. The good news is we have some good initiatives going on in Colorado working toward a single payer within the state. We'll get some studies going and legislation towards that. Just wanted to ask, do you have any questions for the panelists? I really appreciate the perspective of the desire for universal healthcare, but just wanted to bring it back to the discussion at hand. No question for the panel.
Can I comment real quick?
Yeah, please.
And I'm not, obviously, I've said at the beginning of this, I'm a single payer supporter. I really like the comment of how do we talk about waste, fraud, and abuse? You know, family medicine, particularly the history of family medicine, was the mom and pop family practice, where there was a direct interaction with the patient. And there might be a very small office staff. There's now massive billing departments for each of our organizations that figure out how to bilk the system for all it's worth, be it Medicare, Medicaid, or private insurance. And that really is where the waste, fraud, and abuse is. I mean, I think many of you are aware of some shenanigans going on with a local, large, and beloved family practice that's currently falling apart and has had 35 practitioners leave in a very short period of time. And very much what that's about is business practices that were designed to bilk Medicare Advantage plans for money. And I think we need to be aware as we talk to people of highlighting when we talk about waste, particularly the 20 or 30% of the healthcare dollar that goes to administration. That doesn't really make anybody else healthier, but does make sure that somebody's making money. And the joke that I always like to make is somebody's making a lot of money, but it doesn't seem to be me. I just think that we need to keep in mind.
Thank you. Thank you for emphasizing that framing. So I'm aware of time. We've got two people with their hands up. And let me check for the chat. Are there any questions that you want to bring forward that haven't already been addressed?
I'm not seeing anything else. June, are you seeing anything?
No, I don't see
Okay.
anything more.
Okay.
Thank you for that. So let's do this. We've got two hands raised. The more concise and relevant your questions can be, the better we'll be. And so, Suzanne, if you want to moderate these last couple of questions, and then we want to leave ample time to hear from Q. It'll be a wonderful wrap up to hear his lived experience as a recipient here. So over to you, Suzanne.
So Kathy, did you have a quick question or comment?
I'll go ahead and defer to Harriet.
Okay.
Well, and I want to thank you all for inviting people from the Kentucky League to join you. But my question is, and it does tie in, I did put it in chat, how many MCOs manage the Colorado Medicaid?
So, Harriet, you accidentally sent that directly just to me in the chat.
Oh.
And I wasn't sure if you wanted me to call that out or not. So we essentially have 6 what are called regional accountable entities currently in Colorado that are primarily responsible for mental and behavioral health under Medicaid. But we are still not a full Medicaid managed care state. So a lot of the other Medicaid services are still fee for service structure.
Oh, okay. And do you have private? I mean, in Kentucky, a lot of private doctors will not take Medicaid patients.
I mean,
does that happen here as well? You
yes.
did mention it briefly, but I think that it was Bernie who mentioned that briefly. Thank you. In Kentucky, they have just passed a state bill to, well, first of all, one of them left. I think, I'm not sure, I think it was Anthem that left. And now they're trying to cut back to only 3 because the cost of the MCOs went up 10% this past year. So, I mean, the portion of monies that went to them. All right, I'll stop. Thank you very much. This is wonderful. Thanks.
Thank you. Thank you for being
I
here.
do think, just to highlight, it is worth highlighting. It is very difficult for private physicians to take Medicaid. Medicaid reimbursement is not good. And so it often gets cohorted. Clinics called federally funded community health centers get paid additionally to provide the care, but it's still not enough to cover their overhead. And so our community health centers struggle as well. In a lot of states, Medicaid is actually privatized through advantage plans like Medicare is. And I'll just go back to my previous comment, like somebody's making a bunch of money there. It's not me.
Right.
Or you. So I think it's worth looking at those practices. The regional accountable care collaboratives in Colorado has been successful, at least in putting regional providers together to improve the quality of care that we offer here, and provide care management services. But you always when you put a middleman in, the middleman takes some money.
Thank you very much.
Thank you. Thank you for the questions and the responses. Lots of information here this evening on the fiscal situation, on why Medicaid and the funding situation is so important for access to both, community health care, physical health care, behavioral health care, food safety. I mean, we could go on and on. And we get to hear now from someone with lived experience in Medicaid, being fairly new to Fort Collins and receiving Medicaid and getting on his feet. And so Q, thank you for your patience as we did introduce you at the beginning, and glad you're able to be here, and would love it if you'd be able to take yourself off of mute and share your story when it comes to Medicaid and the importance to your family.
Hello, my first name is Quadratula, last name Hamidzai, and I was from Afghanistan, not anymore. I moved to Fort Collins 2021, January 6, 2021. I'm married, I got 6 kids, 3 boys, 3 girls, and I was a former Lieutenant Colonel, Afghan Air Force, and got trained by the U.S. in the United States. And I was a fighter squadron commander in Kandahar, which I was leading half of the country on the MD-530 Foxtrot platform. Recently, I just, since a few years, I'm living here in Colorado. And I do work as a construction field engineer. And in the meanwhile, the program is funded flight school. So I just started flying back to learn back to see if I can get in the air. If you have any question, please ask me, and then I can slowly answer any question you have from me.
Thank you, Q. I wonder if go ahead, Beth. You go ahead.
Oh, yeah. Hi, Q. Yeah, I just wanted to say our church has been involved with Q and his family since they arrived, and they're just a delightful, wonderful family that we all love very much. And Q, I wonder if you could tell us, I know when you especially when you first arrived and trying to, get all the things taken care of with your kids. I know Peg Hoover from our church helped you all a lot with getting services with the doctors and dentists. And could you tell us, some of the needs that you had and how that was covered by Medicaid?
Once we got out of Afghanistan, we got sponsored by our Savior Lutheran Church in Fort Collins, and still they're our sponsor. They didn't leave. They're still our sponsors. Once we got here, we started from the with Medicaid. We didn't have any insurance, and we didn't know anything. So basically, in the church, there was a team especially for medical support. All our kids went to different appointments, vaccination, dental appointments, and all those blood works and check at us, and everybody got like 5 times of each of those shot back, basically vaccinated as a lot. But if we didn't have a Medicaid, we wouldn't be able to do those services because I didn't have money, and I came with one pair of clothes and with a wife and 6 kids. And basically, the Medicaid was really important for us. I mean, team used to provide facilitate our transportation appointments and help us. But in the meanwhile, we did need to have a insurance, and Medicaid covered us a lot on those points.
Q, could you also tell us, I know you shared with me that now that you do have a really good job and were able to, support your family better, but you were able still to maintain Medicaid for the children. You tell us how that kind of works?
Yes, so in the middle of 2023, when I got that engineering job, so I was a lower income person and I moved to double off my salary, and I got a better job than before. And basically, when I send my information to Larimer County right away, and so me and my wife got kicked out of Medicaid because we were kind of in the middle, and the kids were still qualified on the Medicaid. All 6 kids have Medicaid right now. Me and my wife, we are getting insurance from our employer. In the meanwhile, we have to pay up for at least $5,000 a year for both of us. And last year we paid that like within first 2 3 months because my wife was sick, and then we got the free after 5,000 we paid for that. And this is for a family which has low income, a lot of abnormal size of family like my family, or there's more families more than my size of family available in Colorado. It's really difficult for them to maintain their health unless they don't have Medicaid. So my kids are still in the Larimer County in the same program. They are getting benefit from the Larimer County. Me and my wife will just continue on my work benefit.
Thank you.
It's inspiring to hear your story of success and how hard you're working to, find meaningful work and continue to develop yourself and create a system, be able to access healthcare the way you need to. It's very inspiring.
Yeah, it's a blessing for us.
Absolutely. Are there any questions for Q or any of the other panelists, either in the chat or you have any raised hands? Yeah, Jane, I'm seeing.
I'm curious, Q, what were some of the initial challenges, cultural challenges for you and your family when you got here? And how do you like our food?
So our best, let's answer me the latest question. Our best food is McDonald's for everybody. That's we love it. The culture challenges. I was here in the state for almost 3 or more than 3 years in the United States for twice before, but my wife and kids, nobody could speak English. Nobody could. Uh, they didn't know anything about the culture shocks and these things, but luckily we had a good team, and I was treated especially with our Silver Lutheran Church. Basically, they had a culture team, and they used to introduce us to the parks. They used to introduce us to the sports. They used to introduce us to the different, all those downtown parties and these things. So the kids used to get involved, and still they are getting involved from the community. And I let them to learn to adapt. Whatever they have good things, they can save it from the previous culture. But I want them to learn everything good from this culture also. So everybody's adapted the culture. We love the food. We are settled down well.
Fantastic. McDonald's. Now everybody's thinking about McDonald's French fries. Well, really appreciate all of you being here, taking your time this evening to join us to hear about the situation happening here in Colorado, both from a fiscal standpoint, a provider standpoint, a lived experience standpoint. Appreciate that the league hosted this. We did this on pretty short notice, pulling it together, and so the panelists were quick to pull things together and be here as well. So thank you so much to Adam and Dr. BIRNBAUM and CYNDI and Q for being here and sharing information and giving us ways that we can make a meaningful difference to protect our healthcare to the extent we're able to do so right now. Any final comments before we call it an evening?
So Sue, I saw Adam put in the chat about a rally on Wednesday at the state capitol, organized by Friends Center for Health Progress.
Wonderful.
Sue, I did see a note in the chat. I mean, all of these programs are saved and recorded, and it will be available within a few days. It doesn't happen immediately, but within a few days, you can point people that want more information. Also, there's, I find that it's hard to keep up with all the great resources in the chat. And I'm wondering if there's anybody on your team who could provide, maybe on your page on the website, some of the resources that we can look at for taking action.
Good ideas, Pat. Thank you for that. We will, per your suggestion, add some resources to our website. So that's a League of Women Voters, Larimer County, and there's our work and issues teams, and we've got a page for healthcare. We also will send out an email to everybody who registered for this with some of the resources in the chat with the recording so that you can share this with other people. I know Adam has made his slides available, and we'll check with CYNDI and Dr. BIRNBAUM to see if, so we've gotten a thumbs up. Okay, we got thumbs up from everybody. So we'll share the slides and other resources that have been shared in the chat. And please share broadly and take action. You've got some ideas and some great resources. And so my wish is that as a result of our time together, we all go out and do something that's going to make a difference for our community, and join forces with other partners in the community and other friends and families and doing something so we can have broad impact. So with that, I thank you all for being here, taking your time. Thank you to the panelists. Thank you for sharing your stories and expertise and passion, and wish you all a good night. Bye now.